Hello everyone. Now in this video we'll be discussing on the topic of acute leukemia. Okay, so what is acute leukemia? So this is an cancer of disease of hematopoietic system, the system which actually forms the blood cells. So in that system, if there is cancer, then that cancer is actually called as leukemia, and we have acute leukemia. As a result of mutation, what is the cause? As a result of mutation in the DNA of the progenitor stem cells, process of cell of maturation is disrupted. So the meaning is that due to mutation in the DNA, the progenitor stem cells, which actually forms the matured cells, are actually disrupted, and due to that, they are formations of immature cells. Okay, so in acute leukemia, large number of immature blast cells arises from which the tumor is formed. So grows in the bone marrow and tends to metastasize. So it tends to go to other places. Now, what are the causes of leukemia? First is ionizing radiation. So therapy, any therapy, like if the person is going on any radiation therapy for any type of tumor or cancer, so in that case the person has the chance to develop acute leukemia. Or any exposure to carcinogenic substance, any carcinogenic addiction to any carcinogenic substance cause some viral diseases, can cause household factors like additives, any artificial additives in food, and smokers, hereditary predisposition to cancer, any family history. Now, classification of leukemia, we have on the basis of duration, we have acute and chronic. So we are discussing acute here, and on the basis of the cells, what is involved, like lymphoid cell type and myeloid type. Okay, so we have two types: acute lymphoid leukemia and acute myeloid leukemia. So acute never turns into chronic in this case, and chronic never turns into acute. Now, predominance of certain tumor cells like blast, cytic, and undifferentiated. So these are the cells on which we can further classify. Okay, so this acute lymphoblastic leukemia is mostly diagnosed in any age, and can has been diagnosed from the age of 10 to 102. So this is the range till now. And ALL, that is acute lymphoid leukemia, is lymphoblastic leukemia, is most common in children. 30% of malignant tumor of children are actually of this acute lymphoblastic leukemia. Now, hereditary predisposition to acute lymphoblastic leukemia are like rare constitutional syndrome with an increased risk of developing ALL, like rare constitutional syndrome can there, family cancer syndromes, polymorphism of non-coding DNA can occur, gene mutation of acute lymphoblastic leukemia. So you can see this diagram here, how the normal blood bone marrow actually looks. You can see this is the normal side, and this is the monograph, or you can see AML, acute myeloid. This is the case of acute myeloid leukemia. So these are the normal picture. You can see RBCs and other cells, neutrophils, basophils. So this is the bone marrow, and in this case you can see AML is present. This is the acute myeloid leukemia cells, which you can see in the bone marrow peripheral blood smear. Clear? This is the blood cancer. You can see this is the bone marrow, and after we have taken the microscopic examination, so we can see it here. This is a normal blood. Okay, and in this you can see leukemia, abnormal cells. You can see it here. These are the cells. So these are the leukemia. Clear? And these are the types of leukemia. You can see this is chronic lymphocytic leukemia, and this is acute lymphocytic leukemia, and this is chronic myeloid leukemia, and this acute myeloid leukemia. So these are the histological findings you will see in this case. Okay, so how the patient can come, not the patient, what are the types, like same, these are the types. You can see these are the diagrams. Okay, so these are acute leukemia found in grows quickly, common in children. This lymphoblastic, and myelogenous is actually common in adults and children. And chronic lymphoblastic is common in adults for more than 55 plus age, and this is also common, but it grows slowly. Okay, now what are the investigations we can do? And now symptoms, actually. Now symptoms, the patient will have fever, sudden rise in fever, chills can appear, sore throat, joints weakness can there. Okay, and pain in joints, bones bleeding. There can be many patients have enlarged lymph nodes, spleen, Okay, and when erythroid germ that give rise to RBC is suppressed, anemia and hemic hypoxia can develop. So there can be decrease in the level of oxygen, weakness, fatigue, and pallor can there. Okay, so these are the symptoms. Weight loss can also be there. Clear. Now what can the treatment we can do for ALL? So the main method of treatment for acute LL is chemotherapy. Main method is chemotherapy, and therapy for achieving remission is the another type of therapy. Like 3 drugs are involved: glucocorticoid, vincristine, asparaginase, and 4 drug can be anthracycline. And these are given for 4 to 6 weeks. Okay, administration is done. So if any bacterial infection arises, risk of increased neutrophils, that is neutropenia, so we can decrease it by giving levofloxacin. We can administer dexamethasone after a week. Glucocorticoid. What is consolidating therapy? It is done by cyclophosphamide, cytarabine, and mercaptopurine. So these are the 3 drugs which are involved in consolidating therapy for acute lymphocytic leukemia or lymphoblastic leukemia. Now what are the supportive therapy? Maintenance therapy usually lasts for 1 year, and it consists of daily intake of mercaptopurine and weekly intake of methotrexate. So these are the drugs which are involved as a supportive therapy for 1 year. Molecular therapy can be controlled. We can control genetic mutation by molecular therapy. Gene changes we can stop. Immunotherapy, we can give antibody based therapy, in which we can blinatumomab or inotuzumab. So these are the monoclonal antibodies we can give for the patient. And what is a T cell based therapy? It is a T-cell cell. So this is the immunotherapy for the ALL, that is acute leukemia. Actually, overall it can be lymphocytic or it can be myeloid. Thank you. This was your acute leukemia.